2 new studies recently came out in support of low-carb nutrition, but with any studies, we have to be a little careful how we interpret it before we get too excited. I'm Dr. Brett Scher, medical director at dietdoctor.com, and I want to tell you about these 2 studies, the good part about them and the part where we have to be a little bit cautious about how we interpret them. The first one, and Francisca Serra wrote an article about this at dietdoctor.com. It was a community-based study comparing 2 groups of patients with type 2 diabetes. So it wasn't randomized. Part of them had already chosen to be on a low-carb diet for at least 3 months, and the other 4 sort of continued their standard care. And the way the study is being sort of publicized was there was a dramatic improvement in the low-carb group. And it's true. The low-carb group, the weight loss was profound. Sorry, I'm bringing it up here. They lost an average of 27 pounds compared to the control group who lost only 1 pound. 27 pounds versus 1 pound. Pretty impressive. And so this was a 20-gram net carb diet, which is pretty good. Now the problem though, here's the problem. Because of the way this trial was structured, the people who went to the low-carb group saw weight loss specialists, obesity medicine specialist physicians, and the people who went the usual care saw endocrinologists. Well, the people who went on low-carb, there's also 50% of them were on a weight loss drug, phentermine. So right away, we've got serious confounding variables. So the question is, all that extra weight loss in the low-carb group, was it from the low-carb or was it from the weight loss drug? And the other benefits, let me tell you about the other benefits. The A1C in the low-carb group went down to 6.7 compared to 7.8 in the usual care group. The average fasting blood sugar dropped by 43 milligrams per deciliter versus only 8 for the usual care group. 100% of the patients in the low-carb group who took insulin were able to discontinue it compared to 23 in the usual care group. So all these extra benefits, was it just because of the extra weight loss and the weight loss drug? Or did it have something to do with the low-carb diet itself? Now, the authors said they crunched the numbers, they did the statistics, and there were independent changes. But I've got to be honest, I'm still a little skeptical. It's not the highest quality evidence. I really wish they didn't have the confounding variables of that weight loss drug. So the reason why I bring this up is because we have to be honest with ourselves. You know, with my bias that low carb is a great intervention, I could rush out and say, look at this study, it's great, and just publish the headline. But I think we need to be better than that. I think we need to talk about the details and how the details influence the results. So, you know, we have plenty of other evidence that low carb diets give you results like this. The Virta Health trial, other non-randomized trials have shown similar results to this. Maybe not as much the weight loss difference, but the A1C, the glucose, and getting off of insulin. But for this trial, I'm going to file it at the bottom of the list because of that confounding variable with the phentermine. Now, the other trial also had some interesting findings. So this one came out of Italy, and they enrolled 22 overweight adults with no other chronic conditions. And they just put them straight into a low-carb diet. So there was no usual care group. There was no control group. It certainly wasn't randomized. And after 6 weeks, they lost 4 kilograms. They lost 6 centimeters from their waist, 3 kilograms of fat mass, and their insulin levels dropped from 8.7 to 4.9. Their triglycerides dropped from 99 to 70, this milligrams per deciliter. And their HOMA-IR measurement of insulin resistance dropped from 1.8 to 1.1. So obviously some improvements there. And that's sort of what we're used to seeing, right? Again, not a surprise. I like that I can say it's not a surprise that we have plenty of evidence now showing that low-carb nutrition does this. Would have been nicer to see it compared to a control group, but that's okay. You know, we'll take it for what it is, but again, file it as a little bit lower level of evidence. But what this study also did was they looked at endothelial function, so sort of the function of your blood vessels. And they did it by measuring what's called a flow-mediated dilatation, or FMD. And it improved in this study when they went on a low-carb diet. So all that tells us is the low-carb diet was better than whatever diet they were on before. But here's what's important. Some older studies have shown that fatty foods can worsen FMD or worsen endothelial function, but those tend to always be a combination of high-fat, high-carbohydrate foods. So or high-fat, high-carbohydrate diets. So now that they have a higher-fat, low-carbohydrate diet showing that actually can improve endothelial function. I think that's really powerful. Now, the other aspect was they looked at carotid intima media thickness, so the thickness of the wall of your carotid artery, basically, which loosely correlates to cardiovascular risk, and it went down when they went to the low-carb diet. Now, it only went down by 0.1 millimeters, which is a pretty small difference, but it was statistically significant. So, again, the headlines might say dramatically improves CIMT. Well, I don't know if that quite fits. I would be cautiously optimistic about this trial as well. I'd like to see longer term than just 6 weeks to see if it's consistent. I'd like to see a bit of a bigger differential so we can say it's a clinically significant finding. But certainly setting the standard for future studies, that these are the types of things we can look at and should look at because we can see an improvement in these factors as well. Thanks a lot, everybody. Click subscribe down below so you'll get our regular updates, as well as some of our other features here on YouTube. Quick reminder that we've got a podcast, and as the host of the podcast, I think it's pretty good, and I hope you do too. But I want to bring your attention to the most recent one with Jen Eisenhart. This podcast with her sort of wraps up this little series we've had that have focused loosely on the dietary guidelines and our interpretation of them. Because first we had the podcast with Adele Hite, our Diet Doctor's very own Adele Hite, and then we wrote a couple different articles about fat fiction, including another YouTube video I did about fat fiction. And now we have the podcast with Jen Eisenhart. So why so much attention about this? Well, because there's a lot of misinformation in the low-carb world and certainly in the nutrition world in general about the nutrition guidelines, about low-fat diets, nutritional recommendations, what people actually followed, and the sort of health crisis that has ensued. So I think it was worth spending extra time to cover it from a multiple different aspects. So if you listen to Adele Hite's podcast, I think it'll be great to also listen to Jen Eisenhart's podcast and see my YouTube post about fat fiction. It's a great documentary. It's very inspiring, as you'll see me talk about. But as with anything, we have to take it with sort of a skeptical mind as well, to make sure we're getting the right information. I think for the overwhelming majority we are, but it pays to have a little extra nuance as well. So check out that podcast, check out the other podcast, either here on the YouTube channel or at dietdoctor.com.